Achilles tendinopathy affects the back of the heel, where you'll get pain at the back, either where the tendon inserts at the back of the bone, called insertional Achilles tendinopathy, or you'll get pain just further up from this along the actual tendon, which is what we call midportion Achilles tendinopathy. This is very commonly developed amongst long distance runners and with people with tight calf muscles. One of the things you can do to help your clients reduce the chances of developing Achilles tendinopathy is by promoting them to do calf stretching exercises. Calf stretching exercises will help increase how much the forefoot will come upwards, and this will reduce the tension on the Achilles tendon. With insertional Achilles tendinopathy, patients will often complain of sharp pain when they first stand or when they first start to walk, but then it'll start to ease off. But then as they start to walk more and more, they may get a more hot, burning and throbbing pain at the back of the heel. With the mid-portion Achilles tendinopathy, I find this generally affects people who are running or walking longer distances. If left untreated, the Achilles tendon can become thickened, and in the mid-portion particularly, if that's the area of symptoms, then the tendon can become thicker and fibrous over time. If you're not a podiatrist, I would encourage you to try all methods possible, stretching, massaging, anything that can increase the range of motion in that ankle so the foot will come up higher. That will reduce the tension on the Achilles tendon. You can also consider asking them to use a shoe that has a small heel. If you wear a shoe that has a small heel, this sort of slackens off the Achilles tendon a little bit, which might ease the symptoms. Although you don't want to get used to wearing a shoe with a small heel without doing regular calf stretching exercises. If you accommodate the tightness in the calf with a heel raise, it might help the symptoms, but then the calf can adapt and get used to that position. So we don't want this to happen. If you get your clients, even if they are wearing a small heel raise, get them to keep doing the stretching exercises and release as much of the calf muscle as you possibly can. Some trainers will have a heel drop built into them, so they may have an 8mm or a 10mm heel drop, and this basically means that the heel, the thickness of the sole at the heel, is higher than the thickness of the sole in the forefoot. This in turn produces a heel lift within the shoe itself. You can also provide your patients with a temporary heel raise. If you have some heel lifts and you can put them in the shoes, this may just slacken off the tendon for the early symptoms and just to encourage the early healing of this condition. If you are a podiatrist, then you can definitely work on all the stretches and exercises with them as well. You can also work at maybe looking at doing a gait analysis or producing some custom orthotic devices with a heel raise potentially. In some cases, you may need to look at imaging to check the area to see whether is it the insertional Achilles tendinopathy, is it the mid portion of the Achilles, is there any neovascularization in the mid portion, for example, are there any therapeutic injections that might help this particular patient. Another great treatment that podiatrists can provide their patients with Achilles tendinopathy is shockwave therapy. Now, shockwave therapy effectively is a small ball bearing inside this gun barrel, and the ball gets fired up repeatedly towards the end. The vibrations of this ball bearing at the end travel into the tissue, which increases blood flow and inflammation to the area and speeds up healing time. This is rated absolutely excellent for this type of condition. The normal treatment plan is 1 treatment a week for 3 weeks. If you tried your manual therapy methods and you've released the calf muscle as much as you possibly can, maybe you've got them to wear good shoes that have a small heel raise, but it's still not improving, then this is when you really need to refer them on to a podiatrist. One of the ways of assessing this is by trying to stretch the Achilles tendon, and you can see lots of cases people have tight calf muscles, and that could be one of the underlying problems that's causing this condition in the first place. And you can do that by lifting the foot upwards. So if you pull the foot upwards, you'll be able to gauge how tight the calf muscle is, And also, if the patient's symptomatic, when you do that, if it is quite sore already, when you do that, it exerts a lot of pressure through the back of their heel, and they might say, that really does start to trigger some discomfort. Equally, pressing around the area, finding the tender points is also good at assessing exactly where the pain is.